I am Courtney Joyce, and I'm the first patient to receive high-dose nitric oxide at MGH. I was diagnosed at 2 with cystic fibrosis, and then I came to Boston for the hospitals because I originally lived in Arizona, and I got my G-tube when I was 6. When I was in 3rd grade, I had an extended belly because I always had an enlarged liver. It was after recess or something, and someone came up to me who was a little bit older and was like, "Oh, are you pregnant?" I was like, "What?" I went home and I was like, "Dad, someone just asked me if I was pregnant at school," and he was like, "What, buddy?" And I was like, "What does that even mean? What's wrong with me? I think I look normal." So I feel like that's when I realized I was different, I guess.
Well, I've been looking after Courtney since she moved to Boston at the age of 2. It became increasingly clear that her liver was affected by Sept. That led to liver transplant in 2017 with complications, but that left her in a immunocompromised state, more susceptible to infection.
I couldn't stay out of the hospital for more than 5 days without having to come back.
By 2018, Courtney was actually spending more time in the hospital than at home. Her lung infection became increasingly difficult to treat because the bacteria were becoming resistant to all antibiotics that we had at our disposal.
Aches all over my body. I had a fever, I was coughing, and I'm literally, I cannot participate in life. I have to go back and get my treatment so that I can.
Her quality of life was diminishing. She was not gaining weight. She was not being able to maintain her schoolwork.
My doctor kind of reached out to Ryan and was like, "We need to do something."
In the 1990s, Professor Warren Zabel had discovered a way to manufacture nitric oxide as a therapeutic gas, sort of part of one of our legacy medications that came out of this institution. And I had the privilege of working and being mentored by Dr. Warren Zabel. My major focus of research was malaria, cerebral malaria, and it's manifest mostly in children under 5 in sub-Saharan Africa, where I had the opportunity to study the beneficial effects of nitric oxide in children. And so I was asked to head up this team to develop this intervention for Courtney.
I really only remember Ryan coming in and so we have this new thing we want to try. We think it's gonna work.
When your lungs are sick, there's a mismatch between the air space of the lungs and the blood vessels of the lungs. And nitric oxide has a unique role in enhancing that communication. But more recently, we've been investigating whether or not this gas at really high dosing has antimicrobial effects, or an antibiotic.
There's a possibility that it might help you actually have a life outside of the hospital. And as soon as I heard that, I was like, yep, sign me up.
The machines that currently deliver nitric oxide in the ICU setting are peaked out at 80 parts per million. We actually can't deliver anything higher than that. So winter of 2018, our team got together and built a device that allowed us to deliver nitric oxide at 180, 160, 200 parts per million.
My parents were very nervous, but I was just chill. I was like, whatever. But yeah.
We obtained consent from her parents and assent from her, which is important. She was 17 at the time.
I'm super glad that I did not say no when they presented it to me.
We wanted to make sure it was safe and tolerated, and she tolerated it beautifully. She talked to us with her mask on. We kept texting her friends and family.
After a couple treatments, I kind of was coughing a lot, and that was when I was like, oh, I'm actually coughing up old stuff. Stuff is coming out, something's happening.
The bacteria that were infesting her lungs were actually losing ground.
One of my doctors, Kelly, came in, and she was on the verge of tears. Oh my God, we have great news.
What was really interesting, and we didn't entirely expect, is that some of the first culture data from her sputum shifted, and the bacteria were now demonstrating susceptibility to antibiotics.
My dad started to tear up, and I was like, oh my God, this means when I'm home, I have an option to try an oral medication.
She was requiring admission every 4 weeks, every 2 months, every 3 months.
Things were turning around. There was light at the end of the tunnel.
Her quality of life was improving. She was gaining weight. Her blood sugars were stabilizing. She no longer needed a G-tube that was actually ultimately removed. She graduated from high school on time.
Now I get home and I can actually make plans in a month in advance because I know I'm not just gonna go right back into the hospital.
She's told me, I don't know what to do with my life because her hospitalization, her illness defined her, and she's now able to seek out new ways to define herself.
I'm proud to be a first patient because I feel like I definitely opened doors for other people.
Over the last 3 years, we've actually treated her over 4,000 minutes, or about 73 hours total, which has helped our team gain confidence in the safety and feasibility of delivering.
I know some people were treated with COVID, which was really cool to hear.
Our treating dozens and dozens of COVID patients confidently with high-dose nitric oxide really was catalyzed by her case.
It's actually funny because I saw it on the news. I was like, "Ooh, that was me," and I recorded it and I sent it to my friends. They're like, "Oh my God, look at you! You're on the news." I'm like, "Yeah, basically, no problem. You're welcome."
There's a level of confidence that comes out of this institution with its 200 years of experience and brilliant providers, physicians, nurses, nurse practitioners, everybody at the bedside with this major focus of enhancing patient care. And there really is this incredible cultivation of innovation and being willing to take those first steps.
My name's Courtney Joyce and I am a MGH first patient.